Good morning, everybody. Thank you all for coming out to LouVax here today, and thanks for all the coverage that you've given us for quite some time here, as we've done a really nice job in the community getting people vaccinated. Of course, we're now on the march to herd immunity, and so we're going to have different strategies at different places at different times as we pursue that, and it gets a little more difficult as we get to folks that are a little vaccine hesitant or vaccine skeptical. Before I started talking about volunteership here today, I do want to note that today's a pretty solemn day for the community in that with the reported death last night, Louisville now has reached 1,000 of our fellow citizens that we've lost to COVID. So when you think about that tragic toll, we reported our first death a little over a year ago, and here we are at 1,000. And we're close to a finish line if people stay focused. We've got a race right now between the vaccines and the variants, and there's folks that are getting tired of COVID. I get all that too, but I hope they can take this milestone, this sad milestone of 1,000, and say, wow, we don't want that to continue. Because most everybody now knows somebody that's been touched by COVID, and it's not fun. And when you lose somebody in particular, it just leaves a hole in your family and with your friend group. And so everybody, please use this sad milestone to stay focused, to help us get through this terrible pandemic that we've been through here, and do that in honor of those that we've lost, please. Okay, we came here to LouVax today to update everybody on the latest in our battle with COVID-19, but we also want to celebrate the incredible volunteers who have made LouVax such a tremendous success and are playing a super critical role in keeping the virus at bay while we're going about vaccinating more Louisvillians each and every day. It comes at a really great time to highlight volunteerism, obviously, because we are in the middle of Give a Day month. Give a Day started with 1 day, and then we expanded it to a week, and then to 10 days. But we said, why not just make it the whole month of April? So it's the longest Give a Day that we've ever had. It's been modified somewhat this year because of the pandemic is still with us, but this is the ideal place to serve as the symbol of the traits of volunteerism and compassion in our city. And as we announced last week, the opening of the state's new vaccination site, it will be the biggest site in the Commonwealth. It's just down the street at Cardinal Stadium. It means that we're able to transition our public health resources here at LouVax. So we're going from LouVax to what we're calling LouVax Mobile, right? So we're taking vaccines to the community, to areas that have been more difficult to get to mass vaccination sites like this. So I do want to encourage everybody to sign up for Cardinal Stadium opening April 12th. 28 lanes for vaccinations there. There are plenty of openings. So want to make sure that we get people as they're back from spring break, if they went there, to be thinking about, okay, let's get vaccinated, because I guess everybody can get vaccinated now that's over 16 years old, right? So a lot of folks have been used to over 70, over 60, but now as the vaccine supply has expanded greatly, make it a family affair, okay? Go ahead and take your whole family over the age of 16 so that you can vaccinate it and be part of the history that's taken place at Cardinal Stadium. You'll remember one long ago when we were just saying we need more vaccine, we need more vaccine. So we're really far ahead of the game now in terms of supply and capacity compared to the predictions that we saw just a few months ago. So that obviously is tremendous as we work toward getting ahead of this vaccine. Now, there's always a but. Have you noticed that with this virus? Because one of the things that we've said from the very beginning is you have to be humble to this virus. The virus's job is to outwit us as humans so it can stay alive as long as it possibly can. So the bad news is that we're seeing surges, a fourth surge in the virus in a variety of states. And if you look at a map, we're surrounded by states that are going through some type of fourth surge right now. So on one hand, we're closer than ever, and we've done a really nice job in Kentucky and a really nice job in Louisville, but we're having surges in other parts of the country. We do not want that to happen here. The other thing is the virus continues to mutate as well. And there's now double mutations and these other variants that are now more infectious and they are more deadly. So it's this race, vaccines versus variants. That's why you got to get the vaccine to help us get to herd immunity. So to bring us up to speed on all of the data with where we're at with the virus, I'd like to turn it over to Dr. Sarah Moyer. Dr. Moyer is the director of the Public Health Department, obviously. And when you think about what her team has done to mobilize our community and our department and volunteers against this once-in-a-century pandemic, it's really nothing short of magnificent. So just big kudos to everybody at our Public Health Department and all the volunteers and all the healthcare systems that have made that possible. So Dr. Moyer, I know you're tired, but you should be proud as well. So Dr. Sarah Moyer.
Thank you. Well, thank you. All right, well, good morning, everyone. Thank you for being here today. Before I get started, it is National Public Health Week, so as you guys leave today, make sure to give a high five to all our public health heroes that we have out here and across the city. I know they have been working very hard this last year, and I'm incredibly grateful for everything the city's done to help us get through this pandemic, so please make sure to thank them on your way out. Before I go into the data, I know nationally we've been seeing news coverage in the recent weeks about COVID cases and hospitalizations spiking at alarming rates across the Midwest, Northeast, and other areas. But it brings me comfort knowing that it's not the case here in Louisville. Since January, the number of weekly COVID cases, hospitalizations, and deaths in our city have declined drastically. While those numbers have plateaued in recent weeks, they are still on a downward trend. And that's the sign that the community is following the safety measures of wearing masks out in public, staying 6 feet apart, with social distancing, washing our hands as often as possible, and getting vaccinated. So as I turn to the data, this week we are still in that alert level orange. We had a daily incident rate of 11.6 cases per 100,000 population. There were 624 new cases reported, which is a slight decline from last week, but is still a positive sign and a reflection of all of you that have been vaccinated so far. This last week, we've had 9 confirmed deaths reported to the health department. 6 of the 9 were recent, and the other 3 were reported from that state audit. A significant slowdown and a great way to start April, but we did reach a new milestone, as the mayor mentioned, with 1,000 deaths, 1,000 lives lost this last year. Many spouses, parents, grandparents that will not be with us as we enter this post-pandemic life. As of yesterday, there were just 46 patients in the hospital with coronavirus and 12 in the ICU. For our vaccine data, to date, citywide, 438,034 total doses have been administered between LouVax site and our healthcare system partners. Of that number, more than 142,000 Jefferson County residents have completed the vaccine series, and 357,000 have received at least the first dose. And that's huge. So thank you, everyone that has signed up already and gotten vaccinated. All of our COVID-19 case data, along with vaccine distribution data, can be found on our website. Please follow along there. You can see how your own neighborhood is doing with vaccination, see what percentage of your neighbors have been vaccinated. It's just a really great website, so thank you to my public health team that has put that together. And then finally, just a friendly reminder that it is spring, and then we understand that everybody wants to get outside, get back to pre-pandemic life, but please continue to follow all of our safety measures, and that if you're going out, running to the grocery store, running errands, going anywhere public, just like everyone here, continue to wear your mask, and if you're not vaccinated, please get tested often. The city has plenty of testing capacity, and testing allows us to track the spread of COVID in our communities, identify new cases, and assist those that need help with isolating and quarantining and finding a safe place to do so. So please get tested if you're unvaccinated and traveled this last week, went out to a restaurant, expanded your bubble, or going back into work. And everyone should get tested if they're vaccinated or not, if they experience any symptoms, whether it's a cough, fatigue, new loss of taste and smell. Please sign up and get tested. And then lastly, please sign up to get vaccinated today. Yesterday, vaccine eligibility expanded to include anyone over the age 16. So if you're looking for appointments, you can visit our webpage for vaccine information. That's louisvilleky.gov/COVID-19 to see a list of all the vaccine providers in the city that have available appointments, along with phone numbers and websites to schedule. If you're confused and having trouble, you can always call our helpline at 502-912-8598 if you need any assistance. So don't hesitate. Please sign up today. We have 3 high-quality vaccines that are 100% effective in preventing severe complications from COVID-19 and 90% effective in even getting mild infections. That's really, really good. We all want to get back to our pre-pandemic activities, and vaccination is the way we're going to do that, but we need all of you. So don't delay. Please sign up today. And with that, we also are looking for some more volunteers here at the LouVax site. And as we transition to the mobile sites, we still are going to be relying heavily on volunteers. So please visit our webpage, or you can call the 502-912-8598 if you're looking for a way to volunteer and get involved. So thank you for that, and I'll turn it back over to the mayor.
Thank you, Dr. Moyer. So as we've all been saying, the volunteers have been super critical to this operation from the beginning. They're one of the things that made us LouVax a national model. As you know, we're written up in the New York Times and the Wall Street Journal for our efficiency. And today we got an outstanding group of volunteers with us today. They're with us from Anthem. And Anthem is also, in addition to being volunteers, always helping the community. Today they're donating 500 water bottles, 500 rain ponchos, office supplies, and food boxes to volunteers here. We appreciate that. And that's the compassionate spirit of both LouVax and our Give a Day celebration. So I'd like to introduce Leon Lamoureux. He is Anthem's Medicaid Plan President, to talk about Anthem's involvement here today and maybe help us recruit a few more volunteers as well. Leon.
Thank you, sir. Well, thank you, Mayor Fisher, and thank you, Louisville Department of Health. This is an amazing opportunity for Anthem Blue Cross Blue Shield, and a call for all to be able to come out and help to serve one another. As the mayor mentioned, Give a Day is something that started several years ago, and as we realize this vaccine and the effort that it takes to be able to help make this available to the community, I had no idea until we were doing some of the planning efforts to recognize that it takes 3 shifts of 80 people to staff this one location, to be able to do it successfully, to be able to move as efficiently as this is done. I want to first thank our team. We have 80 volunteers here today, throughout the day, that are wearing their proud colors of Anthem Blue Cross Blue Shield. And I'd like to challenge some of our other companies that are out there. We need you, we need your time, we need your support, so that we can be able to get ahead of this virus. Anthem Blue Cross Blue Shield is privileged to have served Kentucky residents for over 80 years. We want to be able to continue to do so, and this is just one example of how we can do that. Great effort has gone into putting this and making these vaccines available to us. It's a way for us to be able to return back to normalcy. So I'd like to challenge everyone out there, if you've got a day to give, who doesn't? Right? Who doesn't have a day to give? Give as much as you can. Give whenever you can. Give in whatever ways you can to be able to serve one another. Again, this is an amazing effort. As we get ahead of this virus, we'll be able to return back to normal. That's our goal, and so we'd like to challenge each and every one to be able to do that. We're inspired by our mission to improve the lives and the health and the community, to help build better, more equitable, and a healthier Kentucky. This is one example of putting our money where our mouth is, to be able to try and help people avoid this terrible disease, to be able to avoid the complications, to be able to avoid the loss of life. It's an easy opportunity to come out, to get vaccinated, to come out and volunteer your time and meet some new friends. So I want to thank, again, the mayor for his insights, for the Department of Health for their tireless efforts to be able to put on something that is this efficient, to be able to help us return to normalcy, and to be able to get back to doing the things that we all love to do. Thank you all, and may you all find it in your heart to give a day. Thank you.
Thank you. May you find it in your heart to give a day. Yeah, even if you can't give a day, give a couple hours. But, you know, I always thought every day you need to at least help somebody and learn something new every day. And if you do that over a while, it really adds up and really impacts the community in a significant way. So we're just happy to focus on it here this month during Give a Day month. But every day is a good day. So thank you, Leon, and thanks again to all of our Anthem volunteers for giving a day here at LouVax during our month-long Give a Day celebration. And remember, anybody can get involved with Give a Day, right? So go to mygiveaday.com, and if you're a nonprofit and you've got a project that you need some volunteers with, you can sign up at mygiveaday.com, and we will send volunteers your way. Want to also encourage companies like what Anthem is doing here to take on a Give a Day project and bring folks together and build camaraderie and focus on the purpose of your company, which the purpose of any company should start with helping to make the community a better place, and do that through helping their individual employees' human potential flourish. And you do that by giving and through kindness and compassion and love. So encourage companies to do that. Certainly houses of worship, nonprofits, anybody can help out. So with that, we're happy to take any questions if you all have them. Yes. Oh, what demographics are known about the 1,000 deaths? I mean, I'll start and then give that to you, Doc. But if you'll remember, especially at the beginning of the pandemic, they're disproportionately older population. That's who suffered the most because of lower immunization levels. And the first part of the strategy to fight that was to give vaccines in our long-term care facilities and to people over the age of 70. That turned out to be a winning strategy because deaths and infections have decreased in that area. Interestingly, in Louisville, from a racial standpoint, the deaths are about equivalent to what our demographics are. So around 70% white or so, 22% black. In different parts of the country, you're seeing a lot more disproportionality in terms of black and brown communities suffering higher death rates, but we're about equal with what our racial makeup is here. Dr. Moore, would you like to add anything to that?
Just to add to what the mayor said, I'm pulling up our webpage because I don't have the ability to do it like we're on the web Zoom, but of our deaths, compared to about 76% of them are white compared to just about 72% of the population being white. So majority of the deaths are white. And as the mayor said, older, majority over 70, almost all of them over 60.
And I think that's an interesting story at some time for the media to understand, you know, why our black and brown communities here did not kind of suffer disproportionality compared to the rest of the country. That's kind of an outlier, and we're trying to understand that as well. So, and really to dig into it too, you got to look at it by age groups, you know, those over 70, 60 to 70, et cetera, but there's some good news in all those numbers. Churchill's been working with the state public health department on making sure the protocols are going to be such that we're enhancing the odds for safety as much as possible. Obviously, the infield is out in the open, outside. We all know that the chances of the virus spreading are less when you're outside. A lot more people are vaccinated right now and or have had the virus. So, you know, based on all that, it's a reasonable risk to take in my mind. I mean, what's going on right now is you can shut down everything and have no risk, or what is that balance that's taking place right now? So they'll be exercising that type of caution. I know they'll be working with our public health department in terms of food service and other issues associated with public health at the track. So it's just kind of a gradual step, I guess, back to normalcy, if you can say that. It'll be interesting to see how many out-of-town visitors the Derby draws this year. And of course, that brings in the complication of potential infections or variants coming to the community that we hadn't seen before. So there's just some variables being introduced. It's about, how many days are we to the Derby right now? Like 25? So that's kind of a long time in pandemic world, both in terms of ability to vaccinate folks, but also in terms of the virus to mutate as well. So I imagine we'll be talking about this getting up close toward Derby Day. So, Doc, you
Covered it all. Get vaccinated today before you buy your ticket.
yeah, there you go. That message, get vaccinated today before you buy your tickets. Given the way situations look right now, we certainly want to support the Derby and all that it represents. We're not bringing in economic development guests this year. We didn't think that would be the right thing to do.
The infield's been notorious for being, extremely crowded. People, drinking, and having good times. Are there any concerns from your standpoint that the procedures in place will not be able to be enforced due to the nature of the infield?
Now, are you speaking from personal experience here? You mean? Yeah, that's right, okay. This is what you observed over the years. I think your observations are correct. But it's going to be a very different Derby infield experience this year, and I mean, that's the way it's been structured. And I'm sure they will have the appropriate reminders in place and personnel to keep folks in check. I mean, this is what we've seen, for instance, like out of Louisville City, the soccer thing, that if you're not complying, then you got to go. And so it tends to produce a more compliant crowd out there. It's certainly, they're not going to take any risk from a public health standpoint because they know if they do that, it's going to come back on them.
So we're partnering closely with JCPS, making sure all of our students get vaccinated. I think they're looking more at private partners right now as we continue to focus on areas that can't come to us for vaccination in the health department's transition. But we want to make sure that all of our 16 to 18-year-olds get vaccinated. So we'll help them make sure that happens. And the mayor reminded me, we have the vaccine distribution task force that looks at things like this and decides who's the best partner and who can get it done most effectively. So we always look at the numbers together, the positivity rate and the number of cases, and even zip codes to try to figure out where COVID is and where it's spreading. And so we've seen the positivity rate continue to decline, just like the state. And so we think we're catching majority of the coronavirus cases. I think testing has declined as people get vaccinated. They're 2 weeks after their second dose. They don't have to do that weekly, daily screening that we were recommended before in the pre and post travel. And so that's cut down on testing as well too. And so anyone who has symptoms, still encourage you to get tested, vaccinated or not. If you are just out and about and are getting screening, you only need to do that now if you're not vaccinated. Sure. I mean, until we get down into the green and we get majority of our communities vaccinated, still definitely recommend mask wearing, even if it's not mandated. When you're out and about, even if you've been vaccinated, definitely recommend continue to wear your vaccine unless you're actively eating or drinking and can't.
And that is not a good thing that their mask mandate is ending. And I know people are like really tired of this, but it's like everybody's competed in a game or something like that, and it's like I feel like we're kind of winning right now, right? I mean, we're having all these better metrics we're talking about, and we got more vaccines, and we know what to do. So don't let up. And just because, well, it feels better, I'm going to rip my mask off. Well, remember the 1,000 people that have died in our community, and kind of dedicate this next month or two to doing all these public health practices so we can get rid of this bad boy virus. So I know some people just think, well, we got to go back to normal. It has consequences to it at this point in where we're at with the virus. And the numbers show that, and the science shows that. And those are stubborn things. Numbers and science does not change. Okay, folks, thanks for coming out. Leon, to you and the Anthem team. Thank you. Nice job, guys. Appreciate y'all very much. Y'all be safe.